Hello, my name is Lynn Vrooman, and I'm here today to give you some brief basic information on an autoimmune disease that's not commonly well known by the general public. So if I were to tell you that my mother just recently passed away from cancer, you probably have a good understanding of what that means. However, if I told you I have another family member that suffers from the disease Myasthenia Gravis, you'd probably ask me what that is. So today I'm going to go over kind of what it is, what happens in the body or doesn't happen, some signs and symptoms, treatments, and tests that are available to diagnose for this disease. So the following information I actually got from myasthenia.org. Myasthenia gravis is Greek and Latin for grave muscle weakness. It is characterized by weakness and rapid fatigue of your voluntary muscles. So anything that you use, basically your breathing muscles, muscles used to wave, that kind of thing. At the onset of the disease, it typically affects women under the age of 40 or men over the age of 60. However, it can affect either gender at any given age. It is a chronic, lifelong disease that unfortunately has no cure. However, there are treatments available to hopefully put a patient into remission where they no longer suffer from the signs and symptoms of the disease. So basically, myasthenia gravis is a defect in the transmission of nerve impulses to muscles. This happens when communication between nerve and muscle is interrupted at the neuromuscular junction. The neuromuscular junction is simply where the nerves meet the muscle. Normally, when impulses travel down the nerve endings release a neurotransmitter called acetylcholine. The acetylcholine then travels from that neuromuscular junction and binds to the acetylcholine receptors, which then activate and generate a muscle to contract. However, when you have this autoimmune disease, your body is creating antibodies against this process. Those antibodies either block, alter, or destroy the receptors of the acetylcholine at that neuromuscular junction, thus preventing the muscle contraction from occurring. So the rest of the information I actually got from the mayoclinic.org. First I'll go over signs and symptoms. Basically, half of the patients at the onset of the disease have problems with their eye muscles. This could be ptosis, which is drooping of one or both eyelids, or diplopia, which is basically double vision. So oftentimes you will see somebody wearing an eye patch that's suffering from diplopia. 1/4 of the individuals at the onset actually have problems with their face and throat muscles. This can alter their speech. It can cause dysphagia, which is actually difficulty swallowing, increasing choking hazards. It can also cause problems with mastication, which is chewing. My family member actually had this problem. She actually used her fist to move her jaw to help with her chewing process. It can also limit your facial expressions. Again, my family member had this problem. She actually lost the ability to smile for a while. It can be a life-threatening disease, which is then called a myasthenic crisis. This happens when your breathing muscles become too weak for them to do their job. So this does require hospitalization with mechanical assistance to help you breathe, and they also do administer some IV or intravenous therapies, and there also are some medications to help alleviate this crisis. And I will briefly describe those right now. So one of the treatments through the IV, it's actually called plasmapheresis. Basically, it's filtering the plasma out of your blood and then replacing it with good plasma, basically taking out the bad antibodies. There's also something called an IVIG therapy, which is basically just an IV bag filled with fluid to give you those normal cells to help you with those muscle contractions. They can also administer medications that help enhance the communication between the nerves and the muscles. They also have medications that suppress your own immune system, decreasing the likelihood that you'll actually make those antibodies against those acetylcholine receptors. They also typically administer a steroid. Steroids are pretty common. They do give you extra strength for the muscles that you are able to use voluntarily. Some of the tests that they use to test for this disease, basically one is just a neurological exam, where they test your reflexes, your muscle strength, balance, and coordination, that kind of thing. They can also do a simple blood test that tests for those antibodies against those acetylcholine receptors. all the myasthenia gravis patients have increased levels of those antibodies in their system. They can also do what's called a repetitive stimulation nerve test. My family member actually had this done, and she can kind of laugh about it now, but it sounds pretty unpleasant at the time. Basically, they attach an electrode over your skin, over the muscle which they wish to test. They basically shock you continuously, seeing if that muscle will fatigue with repeated stimulation. So in conclusion, they don't really know what causes somebody to create these antibodies in their system. However, in some cases, they do believe it has something to do with your thymus gland. Your thymus gland actually helps to create antibodies in your system. So it's common practice for the thymus gland to be removed in a myasthenia gravis patient. While there are no cure, they do have the treatments available. They also do recommend simple lifestyle changes, such as reducing stress, make sure you get enough rest, and if you Google autoimmune diseases on the internet, pretty much all of the websites are going to tell you to follow a gluten-free diet. However, that's a whole nother topic for a different day. So, if you have any questions, please let me know, and I'd be happy to help you out with them. Otherwise, if and when you hear about myasthenia gravis, I hope this gives you kind of a general knowledge of kind of what it is. And other than that, I thank you for watching, and I hope you have a great day.